DSCC stands for the Division of Specialized Care for Children, and we're part of the University of Illinois, Chicago. The mission of DSCC is to partner, help, and connect. So we partner with communities, from healthcare providers to schools to other organizations, to help connect children and youth with special needs to the services and resources they need.
Care coordination is one of the primary services that we offer to children with special health care needs and their families throughout the state. We have a multidisciplinary team that provides our care coordination services. So we have care coordinators who are nurses, who are speech pathologists, audiologists, social workers, and a variety of other human service type backgrounds.
To have a caseworker who knows the ins and outs of Medicaid and the special needs world is indispensable. It's nice to be able to call Robin and say, we need this supplement, but it's not covered by insurance, and we have, a prescription for it. Is there any way that you can figure out how we can get this covered? She's kind of my first line of defense when we come up with any problems with the kids' care.
Our team is trained in conducting a comprehensive assessment. And then our care coordinators partner with the participants and their families to develop a care plan that ultimately focuses on things that are important to the family, as well as identifying some things that may be important for the participant.
When Garrett was 11, care coordinator suggested the transition conference. And this is something I didn't know anything about, but they were like, Garrett is 11 and it's time to start thinking about him transitioning into high school and beyond. So this would be a good conference for you to go to see what his future could be, some options for his future. They understand our needs and our goals that are specific to us, our concerns and all that. And putting that in the care plan to help Garrett and Gavin, live their best life.
There's two main programs within DSCC, the core program and the home care program. And the core program focuses on chronic physical conditions that may make a child eligible for our services, which include care coordination and in some instances financial assistance. There are 11 eligible conditions for the core program. And we also have a home care program that is for children who require in-home nursing services, and that eligibility is determined by the Department of Healthcare and Family Services.
Care coordinators can help work with the participant and the family to understand the treatment plans that have been put together by their providers. Sometimes they can help with troubleshooting, things such as needing assistance with clarifying orders from a pharmacy, or helping them to better understand how to maximize their insurance, or what are the insurance benefits that they have available. Our care coordinators are willing to make home visits and often do as a part of our care coordination efforts. Also, we will accompany when requested to IEP meetings or other meetings at the child's school. And also we'll accompany to appointments, provider appointments when requested, sometimes having that additional person to go with to be able to take notes and kind of absorb some of the information that was discussed at that visit, or to help make sure that the parent is coming across as the advocate for their child that they want to be.
It's not an option. He has to go to a dentist that can put him to sleep in a hospital setting because he could die. These aren't little things. And to have another mouth, another voice to back up you and what's necessary for your kid to develop, there's no way that you can really put it into words what it means.
I often would run into frustrating things, and my first thought was, I'm gonna message Violet because she'll take care of this, or she'll calm me down and help me understand that, that kind of is the way things are, so this is how we're gonna navigate this. Or other times she'd say, let me check into this, I'll get back to you, and then she would take care of things. So either way, it was really nice to have someone who was on my side, looking out for me and helping me.
We are located throughout the state. We're a statewide program. We have 11 regional offices. Chicago, we're in Rockford, we're as far south as Marion. The idea is that our care coordinators are part of that community in which they're working, so they know their community better than anyone else.
Our services are free to anyone who is eligible, and our care coordination team can help identify individuals who meet our eligibility criteria. Even for children, youth, and families who do not meet some of the eligibility for our care coordination services, there are oftentimes additional help and supports that DSCC can help identify or provide for that family. And we would encourage anybody with any question or concerns to reach out directly to our offices, where our team can help make sure that we provide access to the services needed.
Knowledge is power, and you can never have enough resources. Everyone needs a partner, you know, especially in this situation.